Hello everyone, this is Professor Roberts, and as promised, I am going to record this lecture for you, and I hope it won't take the whole 15 minutes. As we look at this slide, I just wanted to reinforce that mental health indicates a capacity to cope effectively with and manage life stressors in an effort to achieve emotional homeostasis. Now, we talked about some advantages of the older adults in dealing with stressors. They have unique strengths, losses, and challenges. They need to promote health, detect problems. We need to promote health, mental health. We need to detect problems early and minimize the impact of existing psychiatric problems. Now, we know advantages of older adults in dealing with stressors. We talked about that. There are advantages. So, in addition, they have unique strengths, losses, and challenges. We need to promote mental health, detect problems early, and minimize the impact of existing psychiatric problems. We need to not focus on those myths and stereotypes. We also need to be cognitive of the patient, know that their cognitive function in later life is highly individualized. I don't know how much to stress that. Also, don't forget to look in your book about the incidence of and prevalence of depression, especially with suicide. We did talk about promotion of health in the elderly must be looked at from numerous perspectives. I won't beat that drum for an extended amount of time, but I do want to reinforce what I said about mental health implies satisfaction and interest in life, mental health, promotion of mental health. No single profile for mental health, please, is individualized. Good mental health practices throughout a lifetime promote mental health later in life. We need to also maintain satisfying interest in activities. Make sure this patient has activities that he or she likes, not what we like for them, but what they like. Also, patient needs to have opportunities to sense a value as a member of society, and also have self-worth. Can't talk, you guys. Self-worth. It needs to be reinforced. Let them feel important. Sit with them. Tell them, listen to their life stories. These are all important. And also, we spoke about the basic human needs. So security to meet basic human needs. I also want to talk about some guideline principles, which include strengthen the individual's capacity to manage the condition, eliminate or minimize the limitation imposed by the condition, act for or do for the individual only when absolutely necessary. But let's not forget some basics. Okay, problems that older adults confront that may challenge emotional homeostasis, assess symptoms as they may be normal reaction to life circumstances. We just discussed some of those things in class. Address the cause of the problem rather than effects of the symptoms alone. And don't forget the need for accurate, astute assessment. Please don't forget to review the PowerPoints that I posted on Canvas. It's more detailed than this. It speaks about depression. I posted a couple PowerPoints regarding signs and symptoms of depression. Make sure your assessment skills are good, treatment modalities, suicide risk, and suicide gestures. As we continue, let's not forget about the depression and needs of the older adult. We kind of left off on this in class, but I just want to make sure that you pay close attention and have close observation of the patient. Careful protection. Make sure that we're promoting therapy. And also, remember, as I said, we want to make sure that we know what the underlying cause is so we can treat the underlying depression. So we also want to make sure that they have a safe environment and nurses' willingness to listen and discuss thoughts and feelings related to suicide. So when we're talking about alcohol abuse, just know that it affects things, it just, you have the patient. I know there's someone that said in class about shouldn't they do what they want to do? True, but listen to this. So alcohol abuse, often a problem that goes unnoticed in older adults. We just kind of brush it off. It threatens their physical, their emotional, and their social health. So sometimes folks like to just drink alone. They don't want to be around anyone else. Social health. Okay, so how about physical? They start having physical problems along with that, and emotional. So the potential for adverse drug reactions while they're drinking. So it can have an interaction with that. And don't forget about safety. They have increased risk for falls, decreased cognition. They're drowsy. They're not really there with it. Abuse and self-neglect. So also these chronic abusers, they're like chronic abusers versus situational abusers. So you have to look at what is going on with the patient. So please remember, we are healthcare professionals. We are not to diagnose. My apologies. As I stated again, healthcare professionals, we do not need to stereotype. We don't know what specific profile a patient is and, oh, that person looks like an alcoholic or that person is an alcoholic. No. So the symptoms, they're secondary to complications. So there are screening tools out there that identify abuse for patients who are abusing alcohol. There are various screening tools. And then also we need to look at the complications of alcohol abuse and also the diagnosis that follows alcohol abuse. I did talk about alcohol criteria. It is in one of my slides that I posted on Canvas as well. But please don't forget about alcohol abuse treatment. Okay, I think I talked about that before class ended, but just in case, treatment and management includes long-term goal is sobriety. The long-term goal is sobriety. Patient must acknowledge the problem and take responsibility. It's good to have family involved in a treatment plan for support. Medication monitoring, making sure no contraindications, medications aren't mixed, and he's taking a dosage that's good for him or her. Alcoholism treatment programs for older adults are rare, but they're there. They're out there. And don't forget about the AA meetings. Let's talk about paranoia. I don't believe I gave you a good definition of it in class. So paranoia is an unfounded or exaggerated distrust of others, sometimes reaching delusional proportions. Paranoid individuals constantly suspect the motives of those around them and believe that certain individuals or people in general are out to get them. The definition for hypochondriasis is a mental disorder characterized by excessive fear or a preoccupation with a serious illness despite medical testing and reassurance to the contrary. For paranoia, its frequent occurrence in older adults. Predisposing factors include social and physical. So they need to explore mechanisms to reduce insecurity and misperception. I will post in the announcement a good website to go on to learn more about paranoia. Also for hypochondriasis, don't forget attention-getting mechanisms, means of control and socialization. Healthcare professionals need to spend time and demonstrate interest while reviewing the complaints of older adults. I have another good website for hypochondriasis that I will also post in announcements. Now let's look at what our nursing considerations would be. So we want to promote positive self-concept. So think about some promotions of positive self-concept. People need to feel their lives have a meaning. Remember that? We talked about that. Take interest in the lives of accomplishments of the older adult. Sit with them, talk with them, see what their history was. Promote self-esteem. Life review, oral histories, and scrapbooks of life events may assist in the self-worth. Also, we want to manage behavior problems. They occur in persons with altered cognitive status who are incapable of thinking rationally, making good judgments, and coping. You have types of behavior problems. So the first step in assessing the cause of the behavior is assessing the cause of the behavior. I'm sorry, I talked fast. The first step is assessing the cause. Factors that participate in the problem should be avoided. So if you know something that's going to make this person more of what they are, avoid those things. Identify the signs and symptoms that precipitate the behavior. So, and then also as a registered nurse and a nursing student, make sure you intervene in a timely manner. And don't forget about the environmental considerations. Okay, and most importantly, we're going to correct the underlying cause when possible. As I mentioned in class, I want you to make sure that you review this slide and the slide that I posted. Make sure you understand that delirium and dementia, you understand the overview. Fear of loss of normal cognition. Okay, losses that result from impaired cognition. With aging, there is increased risk of, guess what? Delirium and dementia. It's just increased risk of it. So don't forget that your delirium is generally reversible. Dementia is irreversible. So please know the differences between delirium and dementia. Don't forget, what is rapid? That's your delirium. Your delirium. It's rapid, altered level of consciousness. So make sure we have good nursing assessment skills and prompt treatment. We have to make sure that we consider coexisting factors. Interventions during the initial acute stage. So we need to make sure medical stability. Remember, these patients having hallucinations and they're really sick. Minimize stimulations to the patient. Also prevent harm to self and others for the patient because they're just really delirious. And support and realistic expectation. I might be repeating, but don't forget that dementia is irreversible, progressive, impairment in cognitive function affects memory, orientation, reasoning, attention, language, and problem solving, okay? It's caused by damage or injury to the brain. 4.5 million older adults are affected with it. As I talk about Alzheimer's, I just want to point out some important things. It's the most common form of dementia. I would like for you to look at the incidence and prevalence. Remember, changes are happening in the brain. Look at the possible causes that could go. Genetic, environmental factors, chromosomal abnormality, and so forth. I have it in a PowerPoint that's posted. And then symptoms develop gradually and progress at different rates among individuals. Don't forget about the staging. I passed the paper out in class on a global deterioration scale. I did find it online, and I wanted you guys to have an example of it. Please remember, for the treatment and management, no current treatment to prevent or cure Alzheimer's disease. Clinical trials are in place to improve function and decrease the disease progress. Research on estrogen and conflict and results, antioxidants, anti-inflammatory agents, folic acid, vitamin B12, and so forth are all being looked at as treatment management. Medications also that slow the acetylcholinesterase. Please take the time to look at the other dementias, okay? I have them posted on Canvas in your PowerPoint. But don't forget, caring for those with dementia, make sure we're ensuring patient safety and promoting therapy and activity. When I speak of ensuring patient safety, we're looking at problems related to poor judgment and misperception, items to trigger the memory, control the environment, wandering behavior, prevention of abuse, and then also promoting therapy and activity. We're looking at occupational and expressive therapy, varying degrees of reality orientation, stimulation through other activities, touch, modify communication techniques also. The website I have on the PowerPoint is very good. You should go to it. Don't forget about caring for those with dementia. We want to provide physical care, respecting the individual, supporting the patient's family. When we provide physical care, we're doing close observation and attention. We're looking at their eating and drinking, their bathing and skin care, consideration of inability to communicate needs and discomfort, consistency in caregivers. Sometimes they might be doing things because they are in pain, not because they're doing it for some other reason. Please don't forget about the CAM therapies, therapeutic exercises, and respecting the individual. Know the person's unique life history, and we need to improve individuality, independence, freedom, dignity, and cognition. Thank you guys, and I am within my 15 minutes.